everyone, welcome to Sonographers in the Cities. I'm Lynn.
And I'm Giselle.
As always, thank you so much for watching and or tuning in. We have a fun and refreshing episode for you today because we have a special guest. So before we get started, please don't forget to set your notifications and rate us 5 stars on Apple Podcasts. Leave a review if you can. And if you're watching this on YouTube, please don't forget to subscribe to Giselle's channel.
Yes, hello everyone. Welcome to today's episode. We have a very special guest here today for you. If you guys haven't seen our old videos, we do have one, and it's a huge topic that everyone asks us about. So obviously I had somebody who is more educated and more able to answer your questions, and it was basically nursing versus ultrasound. And so today we have Christian here from CMONEYRN on YouTube, and he's going to talk about nursing with us today. So hello, welcome.
Hello.
Thank you for having me.
We're definitely excited to have you on today. And you're obviously a big part of the nursing community. He also does work out here in Las Vegas. We are friends from before school and everything like that. So definitely excited to have you talk about it. He has been on another journey and getting his master's degree as well. So tell us a little bit about how everything's been going on with you.
Everything's been great. I just graduated with my master's degree in nursing for family nurse practitioner back in December. So I'm currently right now studying for the board exam. Right now, my official title is Christian MSN RN. And then once I take the boards and pass, then I could officially attach the APRN title, or in this case, FNP, board certified, which sounds a lot cooler. So I'm working on that right now. It's a work in progress.
That's awesome. Yeah, before we got onto this episode, we actually were talking to Christian about the differences between the titles of nurses and obviously sonography as well, just because in our old video that we had together, which you guys should check out, it was basically kind of comparing nursing and ultrasound. But he had mentioned in that video ultrasound technician, and a lot of sonographers were getting upset about that. And I was trying to talk to them about how the words and the names of these titles can get confusing. And obviously you guys know that Lynn and I had an episode about that. So the differences between all the names of ultrasound technician, technologist, sonographer. So he explained to us that people in his hospital have talked about ultrasound technicians, introduced themselves as technicians. So we wanted to talk a little bit real quick about the definitions between all these things. And obviously we have an episode on that. But for nursing, it can get confusing as well, right? Because nurses have CNA, RN, and then like he said, APRN, FNP, all these things. Can you kind of explain a little bit about nurses and what those different titles can be, especially for people who listen that are students and kind of curious if they should go into nursing or ultrasound?
Yeah, so for nurses, there's different types of specialties. The main one, you have RN, which stands for registered nurse. You also have CRNAs, which are certified nurse anesthesiologists. You also have CNAs, certified nurse assistants, and then you have NPs, or advanced practice nurses. And I think when you kind of have the word nurse in all of it, no matter what in the profession, I feel like the word nurse is associated with all of it. And I was just talking to you, Giselle and Lynn, about it before making this video, was even going into the nurse practitioner route, even though I'll become a nurse practitioner, a fully licensed healthcare provider, the term nurse is still going to be attached to my name. Like some people, they might see me as, oh, you're just a nurse. You're just an assistant to the doctor, things like that. But in reality, titles have meanings behind it. There's so many different meanings and titles behind every type of nurse, but it's important to kind of just differentiate between the two. So you have the CNA, the certified nurse assistant. They work as like the hands, and I can't tell you how much of a help they are to the hospital. Like they have helped me so much as a full-time nurse, just helping me with my patients, transporting, cleaning. We even have some CNAs, acting as secretaries for the whole department. So without them, it's like you don't have this fully, well-oiled machine. So you have the CNAs, which is a big part. So big shout out to the CNAs out there that are watching this video. Then you got the registered nurses that, they're like kind of like also the working hands part of the hospital too. So when doctors, they put out orders, it's the nurses that are there 24/7 with the patients. So 12 hours in, 12 hours off. You have the day shift nurses and night shift working very hard to carry out these orders, to maintain and stabilize these patients in the hospital setting. And then you have other types of nurse specialists too. You can even have like certified nurse midwives, those that are assisting, with giving birth. You also have nurse anesthesiologists, those that are administering anesthesia. So the beauty about nursing is that you have so many different opportunities for growth and development that you don't have to be stuck into this one area. You could go into different routes. You can go into psych, you can go into family practice, you can go to pediatrics if you love kids, OBGYN. So there's different, titles out there. But at the end of the day, I'm really proud of, being known as a nurse. That's who I am. And so even going forward as a fully healthcare provider, I'm still proud to have that nurse as a title. And so that kind of differentiates between all of it. And as a nurse practitioner, what I do is I'm taking the role of a primary care provider. So when you go to a doctor's office, sometimes you might not even see a doctor. You could see a physician assistant or physician associate. That's also what they're known as, or even a nurse practitioner. And we could still do the same job, prescribe medicines, do full head to toe assessments, and we could take full control of your care. So that's the differences between nurses.
I love that. Thank you so much for explaining.
Yeah.
So many things that we don't even know. And obviously, like you said, from our perspective, we just see nurse in the name. And so we don't realize that there's all these little things in between and with each title. So thank you so much for all that you do, and to all the nurses out there, because I, for one, know that I can't do that. And that is why I was able to choose what I wanted to do. I mean, for those who don't know, I was a pre-nursing major, and I had volunteered in a nurse's department, and I saw and I knew, like, okay, I don't think this is for me. And so what I recommend for a lot of people is that if you really want to try or figure out if you can, like, volunteer or be able to shadow a nurse, because I mean, not gonna lie, nursing it's really cool from an outside perspective, but to put yourself in nurses' shoes, I don't know, it's really scary to me personally. But that's why I commend you and all the nurses out there for what you guys do. It's definitely something that I think people can relate, like for sonography students and sonographers, because they tend to look at us sometimes when we come into the room and they call us nurse, and we get called nurses a lot. And I don't want to take anything away from, being called a nurse, because obviously, one, I'm not a nurse, and two, nurses do so much. I don't feel worthy of being called a nurse. And so we can do some things that nurses can do, like, help the patient, bring them stuff. I talk to the nurses before I even see my patient a lot of the times. And just nurses are so great. It's a great profession. Lynn, as a student, when you were in clinicals, did you talk to a bunch of nurses as well?
Unfortunately, I did not, because I was just focused on what I was learning, which is like scanning, patient care. But all the patients that we had who were an inpatient, the first contact to the patient was the nurse. So I had some patients who the nurse had to be there. So it was really cool interacting with them. And it's really fascinating to see that they can do so much. And I know myself, and I know I can't do what they do. So like just how I commend you for doing what you're doing. It's amazing.
Well, I commend you both for what you guys do too as well. I mean, I feel like no matter what, nurses, ultrasound sonographers, we're all part of the same team. At the end of the day, when we're working in the hospital setting, our objective is the same: to take care of that patient, to make sure that the patient, everything is done for them so that they can live a healthier and better life. So I don't really think that, it should be like one is versus the other, one's better than the other. At the end of the day, we're all teammates here, and we're all reaching for that same objective.
Yeah, I love that you said that. It definitely isn't, we're definitely not trying to be saying one is bigger than the other. For those of you who are listening, a lot of you guys are trying to decide what part of healthcare do you want to be part of and do you want to pour your heart and passion towards? Because just remember, you're going to be doing this every single day. And it's okay if ultrasound is not for you. And it's also okay if nursing is not for you as well. And there's a lot of other fields out there in the healthcare profession that you guys can also take a look at. I've talked to phlebotomists, EKG techs, I've talked to so many different people, and there's something out there for you if you're interested in helping others. So, obviously, with all of that, we want to talk to Christian and see how he chose nursing, why he chose nursing, and kind of your route to becoming a nurse. So, how did that go?
Well, growing up, I always knew I wanted to go into healthcare. That's always been like my primary goal. I think as early as kindergarten, when they would ask us, the teachers, about what kind of career path we want to get into when we grow up. Originally, I wanted to be a doctor, and I think it wasn't until high school when I kind of just looked at to all my options. I was still interested in becoming a doctor at the time, but I also had to research like how much schooling is involved, how much money is involved, like how many years do I have to devote myself, just to get into that type of profession. And so at the time, even though I wanted to also become a doctor, I also wanted to look at other alternatives too. So one of the other alternatives was the profession of nursing. And after looking into like the background of a nurse, I saw that, there's a lot of things that both, nurses and doctors do that are very similar. They both take care of patients. They do make a positive difference in society. And then I also got to see like, as a nurse, you're not spending as much time in school to get into the profession. It doesn't cost as much money, but you're still making that good positive impact. And I also looked into it from a whole perspective too. Like I like the flexibility of becoming a nurse. You're working typically as a full-time 3 days on, which means you have 4 days off to spend time with friends, family, significant others. So you have a lot of freedom as opposed to becoming a doctor. If you wanted to go into that route, you're pretty much doing 7 days in a row. Sometimes I see people working up to 2 weeks in a row, and there doesn't seem to be that good work-life balance. And not taking any away from doctors. I love doctors and for what they do, but I just saw nursing as an alternative like opportunity that I could get into, and I ended up falling in love with it throughout the process. So I loved it so much. I actually ended up going back to school to get my master's. So here I am now.
That's awesome. And that's when you know, like, you're really into what you're doing and just to continue your education, which is really great. And I commend you for doing that as well. So, do you believe that since going into nursing, is there another route to go, or do you have to go the 4 years of the BSN route? Like, is there another route, or is that the only route you can do?
So to advance in nursing, you need to have a BSN. And I know that right now you have a lot of programs out there for associate's degrees of nursing. You have bachelor's degree in nursing. And I think eventually, I noticed that a lot of hospitals nowadays, we are trying to transition into encouraging nurses to get their BSN. So between a BSN and associate's degree, a BSN involves a lot more research, and it is also like an additional 1 to a year and a half more of schooling that you can do. So if you go get your associate's degree, you could certainly work full-time, part-time, and go get your bachelor's, but bachelor's seems to be the main focus nowadays. And then once you get your bachelor's, that's when you could go into like your master's degree, because that's like the prerequisite. And then in order to get into a DNP program, which would be my next goal, getting my doctorate, I would have to have a degree, my master's degree first. So your baseline is going to be that bachelor's degree in nursing. And then from then on, you can kind of just advance into different parts of your career. And there's so much like alternative you can do. I'd say for nursing, the typical route is you spend about 4 years of, I would say 2 years, 2 years of prereq work, 2 years into the actual program itself. And then you could start working as a nurse as soon as you pass the test.
That's awesome. I mean, I know when you hear about nurses, you hear about stable career and good money. Is there anything you would want for people to know about the nursing career instead of just like stable and good money? Like, do you want like the stigma of a nurse, like how
Yeah.
would you tell these students about what nursing is truly like, other than those two facts that people always talk about nurses?
That's one of the biggest things about, why some people go into nursing in general, because of the stability of it. Um, Before I go into the other part, I just want to address that with nursing, no matter what, there's always going to be a demand in nurses. We're actually right now in the middle of a worldwide nursing shortage. There's not enough nurses to fill in this demand that the hospitals have. So nowadays we have a lot of travelers that are coming in and out of the hospitals, so we can fill that quota and take care of more patients. But for me, I ended up falling in love with nursing because of the complete opposite. I love the opportunity for growth, the opportunity that I have so many options out there that I don't have to be stuck into just one area. I started off in a step down unit when I first became a new graduate nurse. And after working about 2 years, I was able to advance and go into the ICU. And so in the ICU now I'm learning a lot more stuff. And if I get tired of working in the ICU, I can go to a different department. Or even as a nurse practitioner, I get to see a whole variety of patients, and I don't have to be stuck in just one area. There's just so many specialties. All I have to do is just study hard, go back to school, and get the accreditation for it. So for me, what I would recommend, like for your viewers, if you go into nursing, just know that when you go into nursing, you have a lot of like areas for growth and development. Like if you want to go on a plane, you could be a flight nurse. If you love Disney and cruise lines, you could be a Disney cruise nurse. You could go on, you could work on a boat as a nurse.
That's cool.
That's really cool. So there's so many opportunities there. So you don't have to just, be focused in one area. If you get tired of one area, then you could go on to another one. And you just have so many opportunities of advancement. So that's why I love nursing so much. And it's just a lot of fun, and I get to learn so much in the field.
Really cool, actually. I mean, I do remember that was one of the things that I was drawn to nursing about, was that there's so many different types of nurses. And I think people don't realize that there are that many, because if I realized that before, maybe I would have maybe stayed. Because what I remember I was at a hospital and I was like, oh my gosh, this is like scary, but not thinking about the other opportunities I could potentially have had. So maybe that could have pushed me further into that career. But I mean, everything happens for a reason. So, but for those of you who do know that you want to kind of decide between nursing and ultrasound or anything else, really think about the opportunity, how much you're going to, like how many years ahead of you have, and what you can do with your life, and how many people you can help, regardless of what healthcare profession you go into. So that's really cool. I do remember when you were going into the ICU and stuff like that. Do you think it's harder as a new grad to go straight into ICU? I know that's like something that a lot of people ask me about, actually, about going into ICU or emergency medicine. And obviously I don't really know much about nursing, but they do want to like pursue ER or ICU, and I've heard that it's a little bit difficult. What do you think about that?
Well, first of all, I want you to know, never say never. So don't feel that because you're a new grad, you have to go, into one field before going to those different specialty fields. If your true passion is to go into ICU ER, I totally encourage you to apply. Right now, we have a big demand for nurses. And if you want to go into those specialty fields, now is the best time to go into it. Fortunately for me, like I know for my hospital where I work at, we're encouraging new grads to come and apply, to come straight to the ICU, to come to the ER. So that's where your heart and passion is at. Then I say go for it. And there's nothing, nothing changes, it doesn't hurt to try. You apply, you get your name across the board. And even if you don't get hired, at least you're known by the hiring director. And so when you try to reapply later on with more experience, it'll be more seamless. So just never say never. I'd say just go for it.
That's great advice. I know that Lynn is very passionate about ultrasound. So it's kind of like, if you have that, inkling and you really know you want to do it, just kind of go for it, because the only thing that can really happen is they say no, and then you try to find another job somewhere else,
I have a question. Actually, I had multiple questions,
Go ahead.
but I'm just like trying to like whenever you
Yeah.
say something, I was like, ooh, a question, and then you said something, ooh, another question, and I was like,
Oh, go
okay, now
for
I
it.
forgot a question. So one of the questions, like, because I do get a lot of questions from people asking, like, I'm interested in ultrasound, but I'm also like wanted to do nursing, and I don't know what to choose, and honestly, I don't know anything about nursing, so I can't
Mhm.
really like say anything. So
Yeah.
this is a good opportunity for me to pick your brains a little. And so like in your experience, and I'm sure you've seen a lot, what qualities would make a successful nurse?
I feel like some good qualities are organization. You work well under pressure. I think a big part is becoming a team player, knowing how to work well with others, because nursing is just a big team oriented activity. You know, you need to be able to work well with other people, and also especially customer service. So how me and Giselle know each other way back is we actually worked in the same restaurant, and that was like one of our first jobs starting out. And I can't make that job enough for the amount of customer service skills I was able to get from working there. And so a big part is also customer service, knowing how to talk and communicate with your patients, knowing how well to talk to doctors. Communication, I'd say, is the number one thing. You need to be able to be comfortable to, to get out of your shell and just talk to people, because that's the best way you're going to learn, especially, how you're learning, wanting to know more about nursing. It's all about just asking other nurses, like me, how we feel about the profession. So then that way you can get an idea and perspective. So I'd say teamwork, being organized, working well under pressure, and also just it's being very hardworking. I think those are the qualities of a nurse, and they're the same qualities that you need to be a good ultrasound sonographer too as well. Just having that drive.
Exactly
like
the same.
Yes, it is.
You're
Very similar, yeah.
That's exactly, I think, what we would say too, honestly.
Yeah.
Very similar.
I had another question.
Yeah.
Oh, yes. It just like comes and goes. What is the best thing about your profession that you love the most? Like you can do, I'm sure like you love nursing and you want to do it, you can do it every single day, but what's the best part about it? And like the moment that you feel that you're making a difference? And then what's the most challenging that you're like, oh, like to maybe almost doubt yourself that you're going to the right career? I'm really like, I just want to see like what your perspective are, so that just in case like students are listening, they can have the reality of it.
So, as a nurse, even though you're working 3 days a week, you are still subjected to burnout. You work 12 hours, if 12 hours in, 12 hours out. I like to work my days consecutively, and it's very tiring. But what makes it so rewarding is the look of the patients, at the end of the day when they say, you know what, I feel a lot better, especially when you discharge them, when they get to go home. I remember when COVID was really, really bad during like the first wave, when our entire hospital was filled with COVID patients. I think one of the most rewarding moments that I had as a nurse was when we discharged one of the very first COVID patients home to be reunited with family. And that was really rewarding because you could see like the progression, like, they started off not so good, but ended up going through therapies, treatments, got so much better. And this person was so grateful. I think the entire staff, the family was grateful. And so that's like the most rewarding part, just getting people back on their feet, getting them reunited with their loved ones at home. And that's what I love. And that's what keeps me going with my job as a nurse. But the most difficult part, though, and I did address this in one of my old videos, is death. Death is, as you know, is inevitable in the hospital setting. And being an IC nurse, I encountered it more frequently than ever. It's been a lot more common, and it's very sad but true. But I say that's the most difficult part, especially when you're handling your first death. What do you do? How do you communicate with the families who are very upset, that they lost their loved one? I think that's the most challenging part. But I think once you kind of get enough experience in the field with communicating and being a part of that stressful situation, the more comfortable that you can become in it. So I'd say that's the most difficult part about being a nurse, is just encountering all those casualties. It's very sad, but it's a part of, what I do on a daily basis.
It is part of being a healthcare professional, having to deal with that. I've
Yeah.
actually too, as a sonographer, had to kind of navigate that as well, because there are times where I've seen patients coding in the hospital, or I've had a patient code at the bedside. So, it does happen. While for sonographers, not as often as it does for nurses, it does happen in the hospital setting. So I really commend you for that part too, because I don't know how I would be able to deal with that. But like you said, with, experience, you can learn how to kind of cope and react to everything that's happening. So that's actually very, that's a reality, like Lynn said, like the true reality of going into the healthcare profession. So,
Yeah. Like, in social media, most of the time you're going to see like the positive stuff, like it's my first day as a nurse, I'm going to learn a lot. And you do learn a lot. But then the part that people don't realize is all the burnout, all the drama, all the difficulties that actually go into the work. And, I want to say that, I don't think there's any profession that's easy in the medical field. You can't say ultrasound sonography is easy. There's parts of it that are difficult, especially with nursing, becoming a doctor. So I think if you are the type of person that's, you have a growth mindset, you're willing to learn and you're willing to, overcome obstacles and challenges, you're going to be successful no matter which profession you choose to go into. It's just knowing how to respond to those moments.
great advice. I mean, that's 100%, I think, what people need to think about and realize when they're going into the healthcare field. I actually have a lot of people who message me that say that they have a lot of doubt going into the field, or even just being as a student, that they have doubt in themselves. They message me and they're just like, I'm not sure if I can do this, or I watch your videos and it's scary. What do you have to say to those students?
I feel like it applies to anyone. Like, you're always going to have that sense of doubt. Am I going to be good enough? Am I going to be smart enough? Am I going to be strong enough to go into this type of profession? But the only way to know for sure is to actually try. And I feel like if you're still on the fence about what type of profession you want to get into, I would totally recommend trying to volunteer. I know for nurses, you could get into a nurse apprenticeship programs where you could actually work with a nurse the entire day, assist them, and kind of just get an idea. You could work as a certified nurse assistant. You could even can you shadow in ultrasound too? Is there an opportunity to do that as well?
Yeah, there is.
So maybe if you have that sense of doubt and you still don't know what kind of field to get into, I would recommend to try to shadow, follow someone, go for a mentorship, find someone that's already in the field, pick their brains out, and hopefully that will kind of just help encourage you to give that extra push to go into that profession. And so my advice is, don't be scared, just go for the gold. If there's even a part of your heart that says, I want to become a nurse so bad, I want you to go for it. Try to leave the doubt aside and just do it.
Just do it.
Just do it. Yeah. Easier said than done, but just try for it, because you're never going to know if you don't try.
Exactly. Yeah. I 100% agree with that. I appreciate you so much, and I thank you for coming on to the podcast and talking on behalf of, I know a lot of people are curious about nursing, so we really appreciate you. Lynn, did you have any last minute things you wanted to ask or say?
I asked all the questions. I think I really picked your brains, or try to at least. I just want to say what you said is really inspiring, and you taught me more about nursing than I've known before. So thank you so much for your time. Thank you so much for giving us and our audience, the insight that you have. So hopefully it will help prospective students make a decision for their future.
Yeah, it's been my pleasure. And I just want to say, kudos to you guys as well for what you do in the profession. As ultrasound sonographers, both of you have played an integral part of helping me as a nurse working in the hospital. So thank you so much for the two of you. And I encourage those that are watching, your viewers, the students, don't be afraid to talk to other people in the hospital. When you're in the room, even as a student, talk to the nurses. I always talk to my ultrasound sonographers when I have questions, why are you doing that procedure? What's the purpose of this test? Things like that. And we can all learn from each other. So thank you so much for the both of you and for having me on this episode.
I love that.
Yes,
Yes.
thank you.
Yes, thank you so much for coming on. And that's actually great advice to tell the students to talk to others. I think we're just as sonographers are afraid to talk to nurses too, or even like sonography students. Like I remember when I was doing, I would not want to talk to the nurses. So that's good
I'm
advice.
scared.
Yeah, we're already scared.
I'm just like hiding in the corner.
No, we love talking.
Yeah. Oh yeah, nurses, they love to talk. So, like now being on the other end of it, yeah, I totally agree with what you're saying. It's definitely don't be afraid, reach out. And it's good. It's good for the nurses to learn. It's good for the sonography students and sonographers to learn. I think if there was more communication in the hospital like that, I think people would know a lot more just in general about everything. I mean, I don't know how many times a nurse has called me X-ray. So, so that's the thing is as far as like talking to each other, we definitely need to open up that communication gateway. I think if we're trying to make a movement here with all of our social media accounts and just trying to educate more and just be more open to each other. And I think this is purely great, an example to show how much there's miscommunication out there too. So we definitely appreciate you and everything that you have given us. And I can't wait to give everyone this video. I still give people our old video that we made together because it's still so time to time the same, true again. Like they're both great fields and we love our nurses. The hospital could not run without them. So thank you so much. We appreciate you.
It's my pleasure. I appreciate two of you too as well.
Where can people find you on YouTube?
You can follow me on YouTube at my name, CMONEYRN. I post a lot of videos. I've been posting more frequently now since graduating from the program. So if you're interested in nursing, from my perspective, I'll keep making videos for you. And then if you have any additional questions, if there's any questions that we missed that we didn't address in this video, feel free to DM me on my Instagram at CMONEYRN. I'll be happy to reach out to you when I can.
Hey, I'll definitely put his stuff in the description box below. So yes, you guys, thank you so much for listening. Thank you, Christian. I was gonna say CMoney. I'm so used to calling you. Thank you, Christian.
Yes, thank you, Christian. Good luck with everything. We can't wait to see what you will become.
Yeah, and we'd love to have you on in the future. So thank you.
Thank you so much. Take care.
Bye.
Bye.